The cases of measles continue to climb here in the borderland.
Yeah, and we've learned of new cases in both El Paso and Doña Ana County in southern New Mexico. Here in El Paso today, 5 new measles cases were confirmed, bringing the total to 13. Health officials say the latest cases include an unvaccinated man in his 20s, 2 unvaccinated children, a woman in her 50s whose vaccination status is unknown, and a man in his 60s also with an unknown vaccination status. Now, the city also says that if you were at the following places on these dates, you may have been exposed. Those are the Walmart Supercenter on Zaragoza on April 4th, the El Paso International Airport on April 5th or 7th, and Los Toreados in Northeast El Paso. That's a restaurant if you were there on April 4th. We also have that list on our website, kfoxtv.com. So of the El Paso cases, Isleta School District officials say they involve 1 student and employees at Bel Air, Hanks, and Eastwood High Schools. A spokesperson says that the district is following guidelines from the El Paso Department of Health. It's now telling students and staff at the affected campuses who are exempt from vaccines or are unvaccinated to stay home. The health department says they should not attend school for 21 days after the onset of the last known measles case in the building. And this may be longer if there are multiple cases at a campus.
So meantime, in neighboring southern New Mexico here, the first measles cases have been confirmed in Doña Ana County. Health officials say that an unvaccinated child contracted the virus through Las Cruces Public Schools. They say the child does not appear to be a student. The health department warns that several locations may have been exposed, including Memorial Medical Center and a local preschool. Now, health officials say children under 4 are especially at risk, as many haven't yet completed their vaccinations. At Flowers Garden Child Development Center in Northeast El Paso, staff is stepping up safety, checking temperatures, disinfecting toys, and keeping age groups separated to help stop the spread.
Now what we're for sure focusing on is what are the symptoms, and then once we see the symptoms, then children have to go home to get to go be seen by a doctor.
The Texas Department of Health has offered to financially support daycare centers in case of an exposure-related closure.